emotional thinking about how much free clinic has changed my trajectory as a physician, because I came to med school with kind of an idea that I was going to go into a specialty and do research in that specialty and do all those things. And I had never worked in a free clinic before. In medicine, we talk a lot about like treating the patient and not just treating the disease. Even despite that, it's tempting to fall into cynicism or treat medicine like a job. But when I'm at free clinic, everybody around me is here for the same reason, and that's just because of the hope that we get from spending that time with our patients. And it's really beautiful, and I haven't had anything like that really before being here.
I love the free clinic because for me it is truly a place of compassion. We try and practice compassion towards our patients. They are so compassionate back to us. We all are compassionate to the volunteers and the staff. And it's just such an incredible place that people go to be their best self and do the most good that they can. It is a unique space, it's an awesome space, it's a healing space, and I feel very, very privileged to have the opportunity to work and serve there.
As a general manager, I get to see a lot of the ongoings of what happens during a typical free clinic night, but I also have the amazing pleasure of working with and seeing all of the amazing work that students are doing to help our patients. For example, at the beginning of the pandemic, we had students band together and say, we need a delivery system so that our patients continue to get the medications and the food that they needed without unnecessarily exposing themselves. And that's what I love about Free Clinic. It provides a space where students can identify problems that we have in our healthcare community and to really think critically about these problems and how we can actually solve them in creative, innovative, amazing ways that actually work for our patients. I just can't wait to see how generations of students that pass through Free Clinic, how they're gonna make Free Clinic a better place and how they're gonna make healthcare a better place as leaders and as the future leaders of healthcare.
I've been working with the Free Clinic for over 15 years, and I really believe in the mission, which is to help an underserved community and to teach compassionate care to our next generation of physicians. It's been a true honor to work with the medical students, the pharmacists, dentists, legal team, the family medicine attendings, and with my colleagues on the Free Clinic Advisory Board. I've been completely inspired by the open hearts, the dedications of the many individuals who devote their efforts to helping our patients that are served by the Free Clinic.
I'm Samantha Gonzalez, and I'm a pre-dental student that has been volunteering with the UCSD Free Dental Clinic since 2018. I started out by shadowing our volunteer providers and other experienced pre-dental students. I then had the opportunity to become a chairside assistant and x-ray technician. Currently, I am a clinic manager and I coordinate patient care as well as supervise newer volunteers. The free clinics are incredibly important to me because I grew up in a low-income household and my family didn't have access to oral health care. So volunteering at the clinics gives me the opportunity to provide care to those that are in similar situations to myself and my family.
I first learned about Free Clinic as an undergrad at the UC Davis Pre-Health Conference, where I spoke to Dr. Prokosky, and this truly inspired me to become a vaccine manager and student pharmacy manager during my second and last year of pharmacy school. I also felt as an important member of the healthcare team and ensuring that we had the prescriptions ready on time when that was needed. But more importantly, it allowed me to be compassionate to my patients. It allowed me to show empathy, and it allowed me to truly give back to my Latino community. And I'm very fortunate that I have been able to do this and been able to use my education to truly have an impact on patients' lives.
This past year, when we transitioned to working remotely, I had the incredible opportunity to help coordinate our telemedicine visits. And with a team of medical students and other interpreters, we helped our patients learn to use the Zoom platform. I've always felt a strong connection with the patients as I served as their interpreter, but the opportunity to work with them to enable telemedicine visits introduced me to another aspect of their lives. It's always an incredible moment of celebration when the patient's face appears on our screen during our practice sessions, and then we know that they are going to be able to see their doctor face to face in the next visit. I've been profoundly moved and am honored to be able to be part of the efforts that have enabled Free Clinic, even during a time of physical separation, to provide patient-centered and compassionate care.